Hey everybody, this is Dr. Beyer of Beyer Chiropractic in Frankfurt, and I'm shooting this video today to talk about knee pain for anyone out there who may be suffering with knee pain, even bone-on-bone knee pain. Some of you may have come across a video that I shot a little bit ago talking about the type of exam that we do for knee pain. I want to go a little bit more in depth with this video and share why it's important to check other areas of the body and to determine exactly what's causing the pain within the knee. A lot of times within the knee, the pain is being generated more from the cartilage and the tendons as opposed to the ligaments. And it's important to differentiate the two because with ligament problems, it tends to be something that needs to be surgically treated, but a lot of times it can be treated, the knee pain that is, can be treated conservatively because what is causing the pain is more within the cartilage and the tendons and imbalances within the surrounding muscles of the knee. So with a good thorough exam of the knee, we can determine is the pain coming from primarily the cartilage and tendons and muscular imbalances, which can cause some degeneration of the cartilage padding and give you that bone-on-bone condition that a lot of times people unfortunately get to, or is the pain coming from primarily from the ligaments? If the pain is coming primarily from the muscles and tendons and the cartilage, there's very effective non-surgical treatment approaches, which I'll talk about in just a little bit. Another thing that's important with the exam is a lot of times people develop some thinning of the cartilage padding or the meniscus or slight tears in the meniscus because they have some instability within their feet that causes some abnormal stress and strain and forces that go up and through the knee every time people are walking around every day. Same thing with the low back. A lot of times people are a bit misaligned in their hips and or the bones that make up the low back, and that can cause some pain or some wear and tear, which then causes pain within the knee joint. Every time we walk around, every time we step our foot on the ground, there are forces that are transmitted up through what's called the kinetic chain, and those are the three components or parts of the kinetic chain: the feet, the knee, and the low back. So whenever someone's having knee pain, all three components of the kinetic chain need to get evaluated because there may be some contributing problems in the feet and or the low back when there are knee problems. So a good thorough exam of knee pain needs to determine is the problem within the tendons and cartilage or within the ligaments, but it also needs to check out for stability within the feet and alignment problems within the low back. Now, having said that, most docs don't do that. Most docs just kind of, oh, you're having knee pain, here's a prescription, or maybe let's try a cortisone shot, or give a surgical knee replacement recommendation. That's not the route you want to go because most of the time the condition can be treated naturally, and as far as surgery goes, that's not a simple surgery. There's a lot of risk involved. The knee joints, the knee replacements only last so long, and again, there's lots of risk involved and a lot of rehab time. And quite frankly, a lot of times it just doesn't need to be done in the first place because the problem can be treated conservatively. A lot of docs just don't check it thoroughly. We do in our office, but a lot of docs also are behind the times in terms of the available technology in terms of equipment or therapy modalities that they have to offer patients. In my clinic, we have some state-of-the-art technologies including cold laser therapy and HacoMed horizontal therapy. What is HacoMed horizontal therapy? It's a state-of-the-art electrical stimulating device that does what none of the other hundreds of electrical stimulating devices out there on the market do. HacoMed horizontal therapy stimulates the tissues, the cells, both electrochemically, bioelectrically, and biochemically. Most, or not most, but all the other electrical stimulating devices out there just stimulate electrically. Now, what difference does that make? Well, it creates a significant reduction in inflammation within pain signals coming up to the spinal cord and to the brain, and a significantly more rapid rate of healing within the tissues when you can stimulate the cells that way. Same thing with the cold laser therapy. It's a very effective non-surgical way to speed up the healing within the tissues. It's a very specific wavelength of light. We use a class 4 laser, which makes a difference because there's cheaper knockoff type machines out there. We use a class 4 laser that penetrates very deeply and stimulates a healing within the tissues. So with the approach where we identify all the relevant players of the knee pain, meaning what tissues are causing the pain within the knee. Is there any foot instability? Is there any back alignment problems that's contributing to stress along the kinetic chain? And then with high-tech therapy devices such as HacoMed horizontal therapy and Class 4 laser, we've given hundreds of people a non-surgical treatment option for their knee pain, even when it's bone on bone. And people have gotten better a high percentage of the time if they're a good candidate, which we determine through the examination. And that's what I'm offering, is for people to come in and get an evaluation to see if they're a good candidate, and even get the first treatment session to see what it's all about, all for just $49 if you give our office a call at 815-469-8500. One of the nice ladies will schedule you. We're limiting this offer to the first 15 people who call. Last time we did this, we got swamped. We actually got a little bit overbooked. We don't want to do that again. We're limiting it to the first 15 people who call. A good detailed 3-point knee examination. 3 points: the feet, the knee itself, of course, and the low back. Any needed x-rays included are x-rays of the low back if it looks like there's an alignment problem in the back. And the first treatment session with the HacoMed horizontal therapy and cold laser, all for only $49. Give the office a call. We've helped lots of people with knee pain. If you're a good candidate, you could be the next person.